Quick promo. Are you feeling overwhelmed about giving birth in a hospital? Well, you're not alone. My name's Colette, and I've helped hundreds of expecting mothers find their voice and confidence in the delivery room. Join me for this intensive childbirth crash course, November 4th through 6th. It's 1 hour a day, you guys. You can do it. Come live, where you're going to learn exactly how to navigate the hospital system, communicate effectively with your care team, and feel empowered during your birth experience. So whether it's your first baby or your fifth, you deserve to feel confident and heard. Don't let uncertainty stand in the way of your ideal birth experience. I know you can do it. So reserve your spot today. You can go to myfriendsandnurse.com/crash course or check the link in the show notes and I'll get you all the information and get you signed up. Register right now and don't miss this live event. What up, guys? Thanks for joining me, Birthling Podcast again this week. I did a lot of research again with vitamin K. This is something that I've been doing for years with vitamin K because this is one of the education points that I have to do for almost every single parent that comes in. The ones that refuse, I have to do my spiel as well and have an understanding of why they're refusing and respect their decisions when they don't want vitamin K given to their baby. But as long as I have an understanding and I feel that they're educated, then I'm going to respect that, have them sign a consent and be on my way. We'll review what signs to look for if a baby's bleeding, what they need to know before they go home, all of that fun stuff. And I hope by this episode that you realize that you do have a choice and a decision to make. I personally gave my baby, I allowed the vitamin K injection just to eliminate, lower the risk, however you want to put it, as much as possible, having my baby be readmitted to the hospital with some type of bleeding issue. It can overwhelmingly, most of it happens in the brain, where that's the most serious, is when you have an internal hemorrhage, an ICH, intracranial hemorrhage in the brain. Those are the ones that can do a lot of damage to your baby, if not kill them. It is super rare. Let's just be honest about it. I think the numbers are like 1 in 11,000 babies can get this disorder, and then from that, it's an even smaller amount that would die from it. If you want all the numbers, most of the information I got from the book that I tell you all about in the show today, and I'll put in the notes, but it's Vitamin K in the Newborn by Sarah Wickham, and just shout out to her. And these books that she writes, I have one for GBS, I have one for anti-D, placenta, a bunch of stuff. I think she does one for higher BMI patients that you might want to pick up. Yeah, look at it, find it on Amazon, Sarah Wickham, and get educated, you guys. Let's jump into today's episode on vitamin K and why you need to decide for yourself if it's appropriate for your baby. Let's get started. Welcome to the Birthling Podcast, presented by My Friend's a Nurse. I'm your host, Colette Colliker, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. Hey, welcome back to the Birthling Podcast. This week, I'm going to be giving you some information on vitamin K and what questions you want to ask yourself when making the decision. And yes, it is a decision, even though it's so routinely given in most areas of the world, especially middle and high income countries, that this recommendation is across the board. So much so that it isn't really even a discussion your doctor may have with you on whether or not you want it. I hope that it is, but it may have to be something that you actually bring up. Many parents come to give birth to their baby with us at the hospital, not having a clue about what kinds of decisions they're going to be facing when they get there. You know this. That's why I'm doing this first 15 series, right? They're giving most of that power of decision making to the healthcare team, their nurses, their doctors, even their insurance, and that's what they're selecting. It's not that they don't have a choice, right? But that they either don't know that they do or they're made to feel like they don't, right? Those that do educate themselves and then decline interventions and drugs like vitamin K will do so without ever telling their doctor, not wanting to like stir the pot, right? And they'll just come with their birth plan and let their nurse know, like, we're not going to have it, right? When they decline, the nurse is going to have them sign a refusal, leaving the responsibility on the parents if something were to happen. And I think that's fair enough. A good majority come in having no idea, though. When I ask them if they're okay with the baby meds, they usually say yes. And then I continue saying, okay, well, this is the vitamin K shot and the antibiotic eye ointment. And I ask them if they know about these and why we give it. And most just like stare at me like they're not even aware that their baby would receive these drugs right after birth, much less why or what risk would be involved. The usual first question after I ask is, well, what do most parents do? And then it follows with, well, what does my doctor recommend? So let's start there. Most get what we call the eyes and thighs. That's the duo, right? Nickname for where we administer them. The eyes, obviously, the antibiotic goes in the eyes, and the thighs, that's where we give the injection of vitamin K in the thigh. So 98.8% of US babies receive the eye ointment and 70 to 100% the vitamin K injections, depending on where they deliver. In the US, most parents accept the intramuscular, that's the injection, vitamin K, for their newborns, with refusal rates ranging from 0 to 3.2% in hospitals. However, refusal rates can be higher in home births. It's up to 14.5%, and birthing centers is up to 31% refusing. The American Academy of Pediatrics has recommended that all babies receive a vitamin K injection at birth, and this has been going on since 1961. This is because vitamin K deficiency bleeding is VKDB, that's the disease or the disorder, can occur in newborns and can lead to neurologic issues or death. It's a very, very serious disorder. Without vitamin K, the risk of early and classical VKDB is 0.25%, so 0.25% to 1.7% of births. That's how many babies can get this VKDB, or they come with it, right? We don't know who has it and who doesn't. While a late VKDB, so when they get it later, and I'll go into the two different types, is 4.4 to 7.2 per 100,000 infants. So that's the numbers for you. And I'll probably go into it a little bit more in a little bit, but that's just bam, right off the bat. Google, that's what the numbers they gave me and what I found. Parents may refuse the injection, and they're going to refuse it for a number of reasons, including concerns about harm, a desire for a more natural approach, or a belief in alternative methods. And I'm really going to dive into and speak about these, as well as the belief that babies are not deficient in vitamin K. They're not deficient. They have just the amount that they need to have, and they're going to be supplemented, and their reserve or their natural vitamin K develops as they breastfeed, as they get that through the breast milk. And I'll get into that in just a minute. Is that right? But this supplement is really a precaution to prevent VKDB. I'm going to mostly use in this episode a book called Vitamin K and the Newborn by midwife, doctor, and researcher, Dr. Sarah Wickham. That's Wickham. I highly recommend reading this book and the others that she has written for a non-judgmental or unbiased look at the most common tests and medications we give to pregnant women and newborns. Okay, so check that out. I got all of them on Amazon. I've read this particular one about 3 times. I forget a lot of this stuff, so I have to keep repeating and reading. And she really does so much research. She has all her resources and references cited. So and studies go from the 1960s to current, like 2020, 2019. So it's a very good range. She does excellent work. And maybe one day I can have her on the podcast. That's my little pipe dream. But let's move on. So a lot of the stuff that I'm going to tell you comes directly from this book, especially the acronym Pi Day and how she uses that to answer the question if a prophylactic or preventative treatment is right for you, because you're the one that needs to make these decisions at the end of the day. And so using an acronym like Pi Day is a great way for you to figure out if something that the doctors are recommending is good for you. And I'm really going to get deep into this using this book. So I'm pulling some lines straight from the book, and I'm going to pull some quotes. And so just warning, a lot of this is coming from there. All right. So when it comes to the medical side of things, it's kind of a no-brainer that your physician and nurses are going to advocate for the medication and for your newborn to get it. At the A1 conference that I went to this year, it actually got pretty heated when a huge auditorium of nurses who attended the seminar, it was on mental health and advocating for the patient. This discussion started when vitamin K refusal came up. They're all pro advocating for patients that want to refuse things or blah, blah, but someone stepped up and yeah, but what about vitamin K, right? Especially for those NICU nurses that are taking care of these premature babies, and they have to do multiple interventions, lots of poking, IV placements, things that could cause bleeding. And if these babies are coming and having this disorder, this vitamin K deficiency bleeding, then they're just so scared that this is something that parents should refuse. I was like, are you, you have to respect their wishes. Are you asking them the right questions? How are we educating them? I kind of just listened at that point. It got pretty heated. And it was heated one side. I think I was the only one that was like, well, why are they refusing? Why can't we respect that refusal? And why can't we just treat with vitamin K at the signs, especially if they're in NICU and the babies are there and you have such eyes on them and you understand what to look for. As soon as you see any signs of the VKDB, you can give that vitamin K as a treatment instead of a prophylactic, right? Anyways, that was my side point. And I didn't speak up because honestly, I felt like I was going to be one in a sea of probably 800 nurses, and I got scared. I won't lie, but I took it. And I also didn't know, I was like, well, what am I going to say to them? What am I going to, I don't know. I think I just got scared. I did speak up later at the end, and I actually stood up and I was near tears. And I think it stemmed from there. It probably was maybe 10 minutes after the discussion. And I had to speak up, right? Because I think it was about finding your voice. How are we expecting moms and dads to find their voice if I can't even do it? So yeah, I was very shaky and I stood up and I didn't have much of a question, but I just gave my input on what we can do when we possibly don't agree with their refusal or what they decline to, like vitamin K. What can we do in that instance, right? So that's a little side note. That's probably it is a whole another topic and discussion. And I don't want to sidetrack too much because I don't want this episode to be so long. But yeah, it's definitely stayed with me. And I think I'm doing more now just by having this podcast and speaking to moms directly and of course to nurses. But what can we do? So I think this episode, especially whether you are a mom or a dad or a birth worker, how are doulas going to be teaching? How are nurses and doctors going to be teaching their patients? And then what is their response when they still don't do what you're recommending? Excuse me. that we have to check ourselves. And I'm gonna get into that more in just a little bit especially when it comes to vitamin K, because it's so controversial. It's such a hot topic. Like, you have to do this. And then they're like, well, I don't want to. And you're like, oh my God, like, are you going to go to jail? Are they going to arrest you? No, probably not. But they're going to make you feel like it. They're literally going to make you feel like you're going to kill your baby if you don't give it to them. I promise you. So let's get into more of this, right? Where was I? So, okay, let's talk about what vitamin K is. Vitamin K is a fat-soluble substance. It's called a vitamin because we need it to live, survive. It's a vital nutrient. And we usually there's two types. And it's this crucial element that helps your blood clot. All right. It's part of the clotting factors that cascade. And vitamin K actually is needed to create a lot of the factors that are in the clotting cascade. Okay. So without vitamin K, we can't create what is needed for our blood to clot. There's two types, like I said, it's vitamin K1 and vitamin K2. We get vitamin K1 mostly from green leafy vegetables, plant foods, and we convert K1 into K2 in our gut, right? And then we use K2 to process the clotting, what we need to clot our blood, sorry. I'm going to talk about K1 because that is what we use. We use a synthetic version of K1. So we create it and we give it to newborns, usually by injection right after birth, or at least in the first 24 hours. We want to give it as soon as possible. Let's get into why that is. And of course, if it's the right decision for you. Because it's your decision, right? Remember, it's so standardized in healthcare system that it's almost perceived as like not a choice. Many doctors are not going to discuss it with you before, like I said, and your nurse is going to ask you if you're okay with it. They have to, but they're not going to give you like a full rundown of what it is or why they're giving it. They're just be like, hey, we give all the babies this right after birth, and we're just are you okay with it? That's usually as far as it goes. Let's see, my little spiel. What do I say? Because I told you, like, I asked them if they understand it, and they stare at me. I'm going to make sure they understand it. So I just generally say we give it to most babies right after birth, or all babies, as long as you agree to it, to prevent bleeding after the first day. And it helps prevent this bleeding, excessive bleeding, up to 3 months of age, right? Because before that, if they do not get it, there is a disorder that causes baby's blood to not be able to clot fast enough. And what we find is that moms are bringing their babies into pediatrics offices or ERs with this hemorrhaging, internal hemorrhaging. So it's usually in the brain or the gut, and it's awful. It's just awful. And so around the 1960s, 1940s, we found out about vitamin K. 1960s, we started giving vitamin K, started orally, and now we have the injection, which is way more effective to almost eliminate the risk of your baby getting this disorder. So that's why we give it. I usually say there's minimal to none side effects, and I'll go into what the truth is, but I usually tell them, like, it could be there's pain, maybe an allergic reaction or infection at the injection sites. We want to make sure we give the right drug, but any side effect is very, very rare. And so that's usually my little spiel to them. I ask them if they have any questions, and then we move on. Right? So let's get into a little bit more. So like a vaccine, it's a prophylactic drug. It's not a vaccine, right? But it's a supplement that it's going to prevent that very serious disorder. And that is called, again, vitamin K deficiency bleeding. And for the rest of the episode, I'm going to call it VKDB. So VKDB is a disorder, and this is a prophylactic, meaning it's preventing this bleeding disorder, right? For any preventative treatment, let's use PIEDAY, PIEDAY as the acronym. This is going to help you remember the questions you want to ask yourself to know if it's right for you and not comply to this standard umbrella of care meant for all individuals. The whole population should get this, right? Is that really how we want to handle our healthcare and society when we're so individuals, we're so unique? Is it right for you? You are the only one that can really answer that question. So use PIEDAY, right? Because you need to include your history, your values, your genetics, your risk levels, your risk tolerance, right? For a lot of the things that we discuss in the first 15 series and in your healthcare and your birth, when it comes to preventative measures, especially, is it right for you? Because you do have the option to decide, minus a few areas, very few, that refusing is illegal. And I think that's probably in locations that they see very high rates of this disorder, or they're just super conservative and they're going to take your right of choosing away from you. You want to really find out if that's your area or not. And then if it's available, if you're in a very low income, poor country, third world country, as they say, then you may not even have it available. And unfortunately, those places we see higher rates of VKDB. And they don't even have a choice in that matter either, right? It sucks to get that choice taken away either side, whether you can get it or whether you can't get it. When you can't get it, you want it. You just want to be able to decide. Isn't that a nice luxury? I guess I gotta call it a luxury. I don't know if that just came out of my mouth, but it feels that way because it shouldn't be. It should just be available for everyone all the time. And if you don't want it, you don't need it. And, kind of like the vaccines, especially COVID, remember all of that. If we're just forcing people to get stuff, we don't really like it, right? But when we don't have it, we're like, please, where's a vaccine? Anyways, let's start, right? PIEDAY. So let's start with P. P is for the problem. So VKDB, that's the problem. This used to be called hemorrhagic disease of the newborn, so HDN, but let's ignore that. That's old. It was discovered, this disease, about 100 years ago as spontaneous bleeding in a newborn, and doctors found that it was different than trauma bleeding or an inherited bleeding disorder like hemophilia. There are 3 types of VKDB depending on when it occurs. And I think they have it into like 2 types now, and just depends which literature you read. I'm just taking from the book Vitamin K and the Newborn. And she has it basically in 2, but I think we'll discuss the 3rd as well. So there's early onset. This one occurs within 24 hours of birth and is very rare. It usually happens due to medications that were given to the mom, and the vitamin K supplement actually won't do a thing. It's not going to help you. So if you want to wait 24 hours before you give it, it's not a biggest deal because the ones that the vitamin K helps happens after 24 hours on day 2. So usually we just give it to you. The injection is called a depot, and it actually is like this bubble solution that goes into your muscle and it releases slowly over a few weeks. So it's not like your baby's getting the full dose right away. Just so you know, it's like kind of like an extended release tab. Like it's going to kind of slowly dissolve into the bloodstream over time. So you get it on day 1, right after birth, let's say, maybe after the first hour. Then it's going to slowly seep into the bloodstream so that they're able to clot over the next few weeks. And it's going to sustain them and help protect them over the 3 months that they really need it before their body really starts processing vitamin K all on their own. So that's the early onset. Let's move on from that. We're not even going to consider that one anymore because vitamin K doesn't even help it. It's very rare. Very scary, but very rare. So let's move on to a classic onset VKDB. This is the one that usually occurs around between day 2 and 7. So that first week of life. Sometimes they consider it the first 2 weeks of life. So basically it's the first 2 weeks of life, first week of life, depending on what you read. But this is the classic DVD. It shows bleeding under the skin. Sometimes it can also show in the gut. Bleeding can come from the nose. or a wound like a circumcision, or if you cut the tongue tie too early, if you're doing that too early, which that's kind of rare. I would say circumcision, or even from the umbilical cord. If it's unclamped too soon and it starts bleeding a little bit, then they're going to keep bleeding. Kind of very scary, right? Then the third one, so that's the classic one. And then the third one, which is sometimes, if we're looking at just two, it's lumped in with the classic. But this third one is called late onset VKDB. So we have early and then we have late, if you want to just put them in two different categories. This one happens after the first week or two and up to 3 to 4 months of age. So a lot of them say 3 months, but I've seen some articles say 4 months too. The tricky part of this third late onset, is that VKDB could be associated with liver disease that is actually hidden when you supplement with vitamin K, because you think everything is okay. You get vitamin K, so they're processing, they're not bleeding as they should, but they do have this underlying liver disease that isn't caught because you don't notice any bleeding or anything happening. So in a few instances, the late onset VKDB can occur in babies that receive the vitamin K after birth. So most common places that bleeding occurs with the late onset is the skin, gut, and brain. So that's why I always tell, when I do my spiel, I say the most common places is in the gut and the brain. I'm glad I was right there. Okay, so that's what it is. Those are the 2 or 3 different types. We really focus on the late onset and a little bit on the classic. What about I? So Pi Day, right? So I is for incidence. So the next thing you want to know is, okay, so what is the problem? Now, what is the incidence? What is the likelihood that my baby is going to get this, right? How common is VKDB that is now somehow universally, is that the word? Yeah, given to newborns where it is available? It is undeniably serious and scary, you guys, this disorder. And I don't want to be here to scare you, but like, we got to know what we're doing and why we're giving this medication. So, I mean, imagine a baby that's bleeding so quickly and out of nowhere. It's so scary. But it is, at this point, kind of hard to steady babies who didn't receive it because it's so common to give it. So unfortunately, there's just not a lot of studies done on late onset VKDB. There's no randomized control trial. We only have a couple of these small trials on classic onset, and then sometimes we'll, do comparisons of like oral versus injection, and we'll get into a little bit more of that later. But really, these big trials of like not giving it to your baby, we're not going to find, because we're not going to not give it to you. We don't really know the true effectiveness of vitamin K or the frequency and nature of associated adverse effects. We're just giving it to so many babies that if something's happening later on in life because of that, we're just like, we don't know why, because we're not going to go and not give it to other babies to compare. That's just what happens. It's an ethical issue. So, that being said, we do have very true reason to believe that from other kinds of studies, and obviously our own experience of years of administering it, that is very effective to decrease. Because we do know before the drug, all these babies had it and bleeding, sometimes to death, usually intracranial in the brain. And then after giving vitamin K, where we have a huge drop in these cases, huge. So because of that, it's just unethical to deny vitamin K to babies in a placebo group. So controlled blind study at this point is not really an option. A little history, like I mentioned. So before vitamin K was given routinely, about 1 in, I'll just give you the number because this is what Sarah does, is about 11,000, but it's like 1 in 10,000 to 1 in 25,000 healthy newborns suffered from VKDB. So 1 in 10,000, or between 1 and 25,000. Yeah, this is, I'll take a quote from the book of what Sarah tells her patients with regards to the data and incidences of VKDB. Quote, "The estimates of the incidence of late onset VKDB in babies who don't receive vitamin K are varied, and that's inevitable with this kind of research. The figure varies from 1 in 5,600 to 1 in 25,000, but the average incidence of late onset VKDB in high income countries is a robust WHO study is at 1 in 11,000. Okay, so that's the number we're okay. So incidence. What is the incidence of getting this disorder? We'll say 1 in 11,000 chance that your baby could have VKDB if you do not give the medication. There's your answer. All right. E in Pi Day. E is for evidence. Does the evidence show that this preventative supplement is effective? When vitamin K is given at the right dose, at the right time, using the right route, the chance of the newborn getting VKDB goes from low, 1 in 11,000, to extremely low, 1 in approximately 100,000. This number is used when we're talking about the intramuscular injection. Okay. The oral route is a little more complicated. It's known to be effective. It's known to be not as effective as the injection, but still the likelihood is very low. Actually, the many hospitals and providers are going to offer the oral injection because it just feels like it might be easier on the parents to not have to give their baby a shot if they could just give it orally, I guess. But the oral version is actually really bitter. And I didn't know this until I read this book. I had no idea that the oral was bitter and the babies didn't like it. But that makes sense because the babies are always trying to spit it out, right? And if you spit it out, then how much are they actually getting? Is the dose enough? It's such a small amount to start with. How is the gut processing it? Is it even able to? All this stuff. We find that it is, but they need to get the right dose for it to work. And they need to give multiple doses. And we'll get into oral version a little bit better. So, and they also have a concern that with oral, it's the protective nature of it is not long enough to cover late onset. So, whereas like I said, the injection is going to release over a period of time, over weeks, and last for the 3 to 4 months. Oral, you have to give these continued doses, right? So there was this large Danish study that revealed that no cases of VKDB amongst about 400,000 babies who received an oral dose of 1 milligram per week from birth to 3 months of age. When they tried to reduce the dose, maybe by half, it increased the likelihood of VKDB because they found that nearly 70% of the vitamin was removed in bile and urine within a few days. So they just got rid of it. So they had to increase the dose in oral version for it to work. And then they had a new formulation, which they found actually was less effective in babies with liver disease because they weren't able to process the drug at all properly. Then they found that absorption improved significantly when they were given with fats. So remember, it's a fat-soluble vitamin. So when oral dosing, we have the issue of compliance. So you have to be able to give it, be very disciplined when you're giving it. We give it weekly, there's actually no standard of how you give it, but with this trial, it was 1 milligram, and then you give it every week, once a week at the same time. And you give it with food. You give it with fat. So your breast milk or formula, otherwise the babies won't even absorb it, and it's pointless. So basically, if you're considering the oral route, remember that its effectiveness is going to depend on the dose, the preparation, and the parent's ability to give their babies the drug at the right time and the right volume for this ongoing protection. All right, let's get to D. That's the next question you're going to ask yourself. D is for downsides. What are the downsides? What are the reasons that we would want to refuse this prophylactic drug that is so widely, routinely given? So we already covered how serious VKDB is and what the chances are that our babies could suffer from it. So what could the downsides be then? We definitely don't want our babies to bleed and to have any issues in their brain or their gut or whatever. But what about giving it? Why would we not want to give it? So we should look first at the drug itself, the side effects of the excipients or the additives, the preservatives, and the vehicles for carrying the drug. So what's mixed in with the drug, we want to look at that. And then a side effect of how it is administered. Okay, so for an injection, for example, common side effects include local infection, bleeding, bruising, and pain at the injection site. These are uncommon and they're usually very temporary. A more serious risk is getting the wrong drug, but that's rare, super rare as well. And it actually can be eliminated by just having someone there present when any medication, or especially vitamin K, but any intervention or medication is done to the baby. And then if they're giving your vitamin K to your baby, you say, hey, could I see the jug before you give it to her? And then you see the vial. It says vitamin K. It's probably going to have the full name. It starts with a P. I can't even pronounce it, so don't mind me. I'm that nurse friend that can't pronounce anything. But you'll see that it says vitamin K or fin something. Sorry, PHE and something. I don't have it. Wow, that's me. Sorry, I don't know words. But yeah, you can ask them. You'll see it, and you'll be good to go. And then you can eliminate the fact that they're going to get the wrong drug, which could be awful. We do not want to give a medication, especially if it's something that's meant for mom, and they all come in these same little vials, right? Oh God. Sometimes it could be just the hepatitis B that they give, and the vitamin K is over, the vial is somewhere else. And they're like, oops, I've done that before, you guys, but one time, and I realized it before I gave it, but they were going to get both anyway, so it wasn't going to be detrimental at all. But still, that's scary. Always confirm. Your nurses are very good at confirming with each other all the time, so they should have zero issue with you asking to confirm as well. We're all about safety. There has only been one baby on record of having an anaphylactic shock after the injection. So that is absolutely incredibly rare. And then if we look at the additives of the drug, right, though they are minuscule amounts and they're approved for food and drugs, some may not want to give something like salt and vinegar. And that's what she said, Sarah said in the book, like, maybe you don't want something injected into, like any foreign substance injected into your sweet little new baby, and you have more of a holistic or natural approach to newborns and birth, and you're just like, dude, I don't want to give my baby anything that is absolutely not needed. Like, so no prophylactic. You don't want to give the hepatitis B vaccine. You don't want to give the erythromycin. And then it's usually parents just refusing all of it. So, and that's, if they're refusing all of it, that's usually what I believe, is that they just don't want to inject or give any foreign stuff to their brand new baby. And then they'll give it if needed. So if the baby's eyes start looking a little, pussy and like infected, then we'll put the erythromycin. If there's any signs of bleeding, then we'll give the vitamin K. And that's how they're going to go about it. Vaccines, it's not the same. We can't give the vaccine after your baby catches something. We then have to treat the disease and the infection, and that can be a lot harder. So yeah, that's has to be your choice. That's something you have to think about. Some may actually also worry about the amount that is given, right? 1 milligrams of vitamin K is 1,000 times greater than what we have in our bodies naturally as adults. And in premature babies, they have found up to 2,600 times of what is found in an adult. 2,600 times, you guys. That could feel like a lot that's floating around your baby's blood system, right? Even remember, the injection it's going to be given, like, released slowly, but it's still a lot of vitamin K that's in your baby. That's why many times they try to cut the dose of this drug, like especially with newborn babies. So they're still giving some, the premature babies, so still giving some, but helping with that possible bleeding disorder. But because there's such a lack of evidence surrounding vitamin K, we really can't do much comparison, like I said, in a blind study of those who got the drug and then those who didn't. So are we giving too much? Okay, what is too much of this drug doing to our baby? what is all this vitamin K doing to our baby's system long term? But how do we compare that to in a large study? Because like I said, 98% are like 70% are not getting it. Those that are refusing at this point are enough that we could start these trials. So I don't know why Sarah was so adamant, like, we can't do this. This is like my side note. It's like, why not? If moms are declining and refusing, like, get them in a trial. They're opting out, so use them as the control group, right? I guess because blind studies, they give, yeah, you're right. They give placebos, so you're not supposed to know who got it and who didn't. But I feel like we could still follow them. Whatever. I'm sure we will. I'm sure we are, and we will, or we won't. I don't know. Anyways, the potential downsides of giving vitamin K. Let's talk about that. Sarah puts it like this, and this is a quote. The potential downsides of giving vitamin K to a baby is that while we are confident that it does more good than harm on a population basis, we don't have enough data to be certain of what the possible side effects might be and how babies and how many babies they affect. So you can go online and hear concerns, theories, and even some anecdotal stories, but there's just not enough data either way. So this can be a symptom of the culture that we have in our healthcare system, and what health professionals don't properly, like when healthcare professionals don't properly acknowledge concerns. Instead, they like have these promoted ideas that parents know to be untrue, and like vitamin K has no risk, right? So that's what you're going to hear the doctors say, like, no, there's no side effects, no risk. And it's like, yeah, right. And then because they have that statement, the trust is gone, right? This can come off very authoritarian, right? And dismissive, and even very coerced, using very strong language that I'm all too familiar with. It's not surprising, right, that we lose trust in the healthcare system and our doctors and nurses the more that this happens. And then we get more refusals just because they're just not heard, right? Their concerns are not addressed, and they're just dismissed. And it happens so much with so much of what we do in healthcare, right? But with that being said, we can say with confidence that vitamin K did, if vitamin K did anything serious or unusual, that we would have caught on. There have been times that theories have popped up. I heard it's an increase of cancer was a big one, especially this like news article came out and it just like spread like wildfire before it was ever fact checked, and the media ran with it before proper research was done, and it was totally misinformed. And something like that is really hard to fix, right? It's hard to change the minds. I think we have over time. That was a while back, but it's tough. So you have to do your own research and you have to figure it out. But yeah, so those are the downsides. Really, long term, we don't know. We just don't know what the downsides are, and that's the downside. And we give it to so many babies, we're not sure if that large amount is doing good, any harm. And it's more of the additives that we're giving. And again, we're not sure about the downsides of that. So we're looking at maybe just the route, right? If you're doing orally and it's super bitter, is the baby getting enough to even be protective? Are you doing all that for nothing? Or the injection site? So those are pretty much the downsides of it at this point. And that's kind of sucks, but the answer is like, we really don't know. So let's look at the next one. The A, right? We're almost done. Pi Day. And that stands for alternatives. So what are our alternatives? If you're not sure if you should give your baby vitamin K, like, what are your other options? And you have to remember alternatives for any decision that you make, right? Okay, if we don't do this, what other things could we do? I'll give it to you right now. One, and this is Sarah has it in her book. Decide to give the vitamin K injection. That could be your first option. 2, decide to give the vitamin K oral doses. Okay. 3, decide to give the drug either IM or oral, but in a different time frame than's recommended. So maybe you want to wait until you get to the doctor's office. Like maybe you want to wait a day or 2 or a week It's totally up to you. And I always tell my patients that too. Like, I give them these alternatives if they are kind of on the fence. So you're just going to give it a different time range, and you're going to understand why you're doing that. 4, decline the vitamin K, but try other measures to increase vitamin K levels. And I'll give you some of those in just a second. So you're not giving any of those, but how else can we get baby's blood levels to naturally increase? Kind of like that one personally, but whatever, let's move on. 5, decline vitamin K, but become informed about VKDB and know what to watch for and what to do if you're worried. And then the last one is decline vitamin K and do nothing else. So you're just like, I'm not giving to her. I'm forgetting all about it. I'm not looking for anything. Whatever happens, happens. Like, that's your last option. Do nothing is always your last option. So some facts to consider when thinking about alternatives. A pregnant woman may want to try to increase her vitamin K intake while they're pregnant, but it either, for whatever reason, doesn't cross the placenta very easily, or a baby is not able to process it appropriately. It's almost as if babies were meant to have a lower vitamin K in their system when they're born, right? That's kind of in my spiel as well when I say, why are babies coming with lower than an adult or a 1-year-old, lower vitamin K? And there has to be a reason for that, right? And so what I tell my patients is that the babies are coming out through a very traumatic passageway. A birth can cause injury, internal injuries. Their skulls are getting squished and their stomachs are getting squished, and things are happening that need to be repaired. And those stem cells, right? So that's why I'm so pro delayed cord clamping and making sure your baby gets all your blood. Those stem cells can travel very quickly to the places that need to be repaired, right? And if your baby's blood clotted as fast as an adult's, then those stem cells would be blocked. There'd be like a wall of clot and the stem cells would be locked out and they couldn't get to those places, maybe in the brain or the guts. Those are the 2 popular ones, right? That need repair. So there is a reason, and that's why I kind of don't like the name VKDB, because of the word deficient. Like, deficient means that something's going wrong, the baby doesn't have enough, the baby's body's not working properly as it should. Like, who are we to say that's not, honestly, when all the babies are very low levels of vitamin K when born? So how are you deficient in something that everyone has? Right? Like, how could you be poor if everyone in the world has the same amount of money? What makes you poor then, right? So if 1 in 11,000 babies then have this disorder that causes low vitamin K to create this bleeding, something else is going on there that we just haven't figured out yet, because 10,999 other babies are perfectly fine without having this bleeding disorder and with having low vitamin K in their systems. Right? So think about that for a second before you just go around saying that the baby's vitamin K is deficient or too low. Maybe it's just right. But we want to eradicate as best as possible, or really significantly decrease the chances of that disorder happening to maybe 1 in 100,000 by giving a supplement after birth. So if we wait 10 minutes, those stem cells have gone to where they need to go. If we wait an hour, 24 hours, those stem cells have gone. They've done their job. You're good. And now we can supplement to kind of decrease the chances of that really bad thing happening where your baby's internally bleeding or even externally bleeding. So scary, right? So if that's something that you want to reduce the chances of, then go for the injection or go for the oral, or what else can we do? So alternatives could be, well, we know try to increase your baby's vitamin K before birth doesn't happen. So, okay, there's a reason why you don't want vitamin K before birth anyways. Like, that could cause a whole other problem with babies not able to get those stem cells. And we probably saw a lot of that when they were doing this immediate cord clamping, right? So the babies weren't able to get all their stem cells and maybe more problems were happening that created the huge need for vitamin K supplements. And I don't know, something to think about. But what about then after the baby's born? So could mom supplement with vitamin K and pass it to her baby through breast milk? So a few studies have shown that when lactating women took 15 milligrams of vitamin K, they started with 5, they started with 2.5, then they found that they gave 5, it doubled. So whatever they took did pass into their breast milk. And they increased it to 15 milligrams of vitamin K a day to get to the level in their breast milk where it was high enough to be considered an adequate level for protection for the baby, right? Just note that these babies that were studied did get 2 doses of oral vitamin K in the first week of life. So they weren't like opting out of it at all, but they just gave the 2 doses and then they breastfed with mom supplementing. And these babies were found to have 6 to 10 times the amount of vitamin K in their blood than those who didn't take the supplement, and the moms that didn't take the supplement, right? 6 to 10 times the amount. So that's great. And that is a good sign of protection, right? It does not eliminate it by any chance. It doesn't totally eliminate it, but neither does the injection, let's be honest. What about formula feeding? Well, formula has been long supplemented with vitamin K, maybe adding to the idea that breast milk is low, quote unquote, in vitamin K, what I was talking about. Like, who's to say? The idea that what is low is also unknown. We don't know, what is a low amount anyways? What are we even basing it off of? If all women have a certain amount, then we have to base it off of that. And if you're under that, maybe because you're deficient in nutrients or whatnot, something to consider. You have to get a good diet in. What are you eating? Are you eating all your green leafy vegetables? Maybe you just need a supplement of vitamin K. We do that all the time. I take my vitamin D with vitamin K, K2, actually. So yeah, unfortunately, we're not in a place to test this out by not giving vitamin K at birth as well. So again, we don't have the evidence. Shocking. So something interesting is that almost all the cases of VKDB occurred in exclusively breastfed babies. I'm saying almost all the cases, right? So since it's not 100%, you probably won't hear a doctor recommend simply formula feeding for that reason, especially as we found that there's so many benefits to breast milk. So you have to take the supplement if you're breastfeeding, and you can, if you're just formula feeding, talk to your physician about the chances. If you just don't want vitamin K supplement for your baby and you're formula feeding, is that enough? You know how much the baby's getting and you feel safe like that. That's an option. So yeah, that's the feeding parts of it. So what about the people that decide to wait and see, right? Maybe you want to see first if the baby is higher risk before giving it. If they continue, then the parents continue to decline, then they become well-versed in what to look for with VKDB. They will probably not be able to have a circumcision or a tongue-tied division surgery before 12 weeks, just a heads up, because of that risk. And the doctors just are not going to do it. If you didn't get vitamin K, so if the baby didn't get it, then they're not going to be okay, doing any type of surgical procedure. There's no way. Just so heads up on that. They're also going to know, the parents will know when to notify their doctors or bring your baby in when they have concerns or they see symptoms. If you're having any breastfeeding issues, so let's say you're breastfeeding, you think your body makes enough vitamin K, you believe your baby is low risk for this, you just want to wait and see. And now you're not sure that the baby's eating enough, maybe they do have a tongue tie issue, then I would be concerned. Then how is the baby getting the nutrients that they need? Not just vitamin K, but everything. But vitamin A is huge because of this disorder. So maybe if and when more moms opt out of the routine administration, we can do more research and studies. But for now, the consensus is that the safest bet is that IM injection, just so you guys know. But yeah, you have alternative options. Look into them. Talk to me about it and talk to your doctor about it. and research. Remember, get this book by Dr. Sarah Wickham, and yeah, do your due diligence, you guys. That's all I'm promoting and pushing you to do is don't go in blind unless you just really don't care, right? And you're just like, yeah, the doctors have done their research, their recommendations. I'm going to fall into the general public and just give it. So that's why that question comes up. Well, what do most people do? That's their first question to me. And I say, yeah, most people get it. And they're like, okay. And that's the end of their research. I'm like, okay, then, that's a lot. That's how a lot of people make their decision. And I'm not here to judge. I'm like, okay, cool. Great. But that's may not be for everyone. And that's the why in Pi Day. The last one is you. Why is for you. This is actually such a controversial and complex issues, so much so that providers are going to get fired up over refusal. It like causes this great fear around that decision if you're not going to get it. It's crazy. Your nurses are going to be like, what? And then another nurse will come in, then the charge nurse, and the doctor, and there's like, are you sure? Like, well, your baby could bleed to death, and da da da. And that's why if you really do want to refuse, you got to do your due diligence, your research. And for the most part, what I find is nurses and providers are respectful, but just a heads up, some of them are going to get heated like it's their own baby. It's crazy. I don't know if I like it or not like it, but it's a respect level as well. So don't be surprised if they come in and do some more education on you if you refuse. And then again, they'll have you sign that form, and that's it. Just ask them not to mention it again. So, we're gathering information. We're setting a standard of care based on a large group of people in different regions and periods of time, and not making the decision for this baby here and now, right? It can honestly be understandable why someone may not want to just take a population recommended drug, at least without thinking about how it could affect them first. And I hope everyone does. I wish we could discover a way to learn how to know who would be who's more at risk for VKDB. And then we can limit what we have to give our babies, including vaccines. But for the time being, there's just no way for us to know with this VKDB who is going to get it and who isn't. So the way the baby is birthed, what the pregnancy is going to be like, the mother, the family history, so far has given us nothing. We just don't know which baby is going to get this. And so questions are raised sometimes regarding the practice of cord clamping, like I mentioned. Does that make a difference? But so far we haven't found anything. So just because there's no evidence does not really rule it out, right? Just because I'm like, then there's no evidence of that. It's not saying that it's not true. It's just saying we couldn't find evidence for it. So keep that in mind when you're making this decision, right? It just leaves us with no concrete answers, unfortunately. So we stick to what we know. Sarah leaves a quote by pediatrician Edmund Hey, which I liked when summarizing the risk factors that you can take with you as you decide, or if you're a birth worker, how you teach. And he says, quote, babies who do not feed soon, well, and regularly are at measurable risk of bleeding once their limited reserves of vitamin K are exhausted. All babies who are not well enough to be fed at birth need a supplement because their vitamin K stores will only last 1 to 3 days. A few breastfed babies will develop transient VKDB if they are not given a small supplement at birth, probably because early intake is poor. Try to feed those babies. Side note, these newborns are going to sleep a lot. Are they getting fed enough? So you might want to supplement, okay? A very small number of breastfed babies risk a sudden serious bleed when 2 to 12 weeks old if not offered a regular supplement, usually because an unrecognized liver disorder has impaired fat-soluble vitamin absorption. I'll put that full quote, in the show notes because I think it's really good when you're trying to decide if vitamin K is right for your baby. Right? There will be personal reasons and circumstances that each person and family should consider, along with the recommendations of their doctors and nurses. which are based on the evidence given to them for the population as a whole, right? If anything, I hope this episode has given you the curiosity to look into it a little bit further, as with everything you need to decide for yourself and your baby. This includes the preventative interventions that we do for birth in the healthcare system. So use Pi Day. I'll put Pi Day in the show notes as well, the acronym for these decisions, and pick up Dr. Sarah Wickham's book. I'll leave that in the show notes as well for you. It's an easy read. The first part, we pretty much reviewed that. The whole first section is on the Pi Day. Like, how are you going to decide if this is right for you? So empower yourself and your choices with education. That's all I ask. Have a good one, guys. Thank you so much for listening to this review on vitamin K and how to decide if it's right for you and your baby, specifically after birth. You do have options no matter how providers may make you feel, right? So you've got to know them. You have to respect them, and then you have to demand respect for them, for your decision. If you need extra help with that, that's exactly what I'm doing. I have a 3-lesson crash course. 3 lessons, you guys. It's like 3.5 hours. It fills you in on how the hospital works, what your options are, and how to find your voice when you feel like they are taking it away. So visit myfriendsandnurse.com/crash course to get this amazing course, and find me on Instagram at myfriendsandnurse if you want to start working with me now. Next week, I have an amazing out-of-pocket discussion with my friend Mindy, who works with psychedelics-assisted therapy. Yeah, you heard me right. She helps clients transform stuck patterns, healing trauma, and fostering self-leadership, which is totally aligned with what I do, right? But how does a psychedelic therapy correlate with pregnancy and birth? Well, join me next week to find out. Thank you for listening to My Friends and Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.